How do you feel about the world of beauty?
When I was reviewing products, I was in my 20s and I would get sent a $900 cream. And I'm like, but how can I tell if it works?
Perfect.
I don't know.
What are you excited for in beauty or like the trends that are going on now? I feel like you have a good pulse, especially you have teenagers. So adequate dosing and appropriate dosing is like really important for people's muscles.
I don't like filler. I don't like anything that makes me look different. I just want to kind of maintain and not age super quickly.
Yeah.
And you've done a good job with that.
People, I don't think, realize that you can actually remove radiation tattoos. They're like a real tattoo. So
yeah, they're ink. So as people approach menopause and lose estrogen, and people like me who had breast cancer, estrogen receptor positive, does it make a difference and can I use it?
It's the future, like we're augmenting what we have. So call it like augmented beauty.
Yeah.
I'm Dr. Anthony Rossi, and this is Give Good Face, a podcast focusing on skincare science, and how to maintain and shape a healthy lifestyle. Welcome back, everyone, to the podcast Give Good Face. I'm here with my dear friend, Erin Hazelton. We've known each other for about 6 years, so a good amount of time. And we have an interesting history. We're friends, and I've seen Erin through her journey so far, and I'd love to introduce her. So Erin, take it away.
Thank you for having me. Yeah, so we met 6 years ago after I had finished cancer treatment. I came to you to get some radiation tattoos removed.
That's right.
We realized we were both at NYU at the same time.
Yeah.
And
our undergrad days.
I can't believe we missed each other.
I know.
How did that happen?
I'm sure we were in the same circles.
I'm sure.
Out at the same nightclubs. Yeah. And Erin is a writer, mainly fiction now, but was a beauty editor in the beauty and fashion world. She's a mother of two teenagers, and she doesn't look it, and she runs around with them. Yeah. And tell me about your journey, about the beauty writing world, the beauty editing world.
So I started out writing actually when I was 19 at NYU. I was writing for a fashion magazine and ended up doing a lot of beauty as well for newspapers and dailies. It was more sort of the science, like the different ingredients that went into creams or new lasers and that sort of thing. So that's kind of how we started geeking out.
Yeah, we bonded over that.
And I still love that stuff.
Yeah. Especially with you, it's interesting because I can talk to you about the science and you really resonate with that. Like some people love the science, some people would rather not hear about it, but I feel like you take a deep dive into these, and you and I both talk about sort of aesthetics and like the look, and I think both resonate on this idea of like tweakments and minimal change makes a maximal difference.
Yeah, for sure. I mean, I'm not, me, I don't like filler. I don't like anything that makes me look different. I just want to kind of maintain and not age super quickly.
Yeah.
And you've done a good job with that.
No, I mean, I think you're a testament to the way a good lifestyle can really help you. I mean, you've been through a lot, and you are a runner, right? I mean, not only are you running for exercise, but you're running around with the kids, and
which isn't good for Botox, right? I metabolize it like that.
That's true. We talked about that, and I think on another podcast we talked about baby Botox, but how that doesn't really work for everyone because it's not appropriately dosing to that person's muscle. And we do find that people who are really active, and they need to do a study on this, because people who are really active or high metabolizers, we'd say like runners, exercise fitness gurus, they can sort of go through something like a neurotoxin pretty quickly. Yeah.
I mean, it doesn't last.
You feel
at all.
that, yeah.
I feel like but we only do you only do tiny amounts. I think we need to start doing some adult Botox for
because it's a balancing act, right? Like you want to look natural. You want to look
I like
refreshed.
to move. I like to have a few wrinkles. I don't need to be frozen, but at the same time, I don't want them to get etched in. And
totally.
Yeah.
I feel the same way. Like I need to have movement in my face.
Yeah. Or to change your expression so that your smile looks different, or your eyes don't crinkle.
I think we've all been at parties where we see friends who can't move or can't emote, and you're just like, what's going on? Yeah. Of course we're cordial, but I think it's important. Yeah, it's true. It's important to understand that these small differences make a big impact.
Yeah. And I think that it's like, with the laser I do with Brian, what is it called? Yeah, soft wave.
Soft wave, yeah.
I don't know if it's soft wave or soft waves.
It's soft wave, yeah.
Okay.
Yeah.
So that one, you don't really see a difference. I don't think. It takes such a while for it to set in, but
That's the
sort of
ultrasound tightening for people listening. Yeah.
So it's supposed to like tighten everything a little bit, but it doesn't start until like month 2, 3.
Totally.
And then until month 6, right? So you don't really notice anything. And I think we were talking about this at dinner the other night, where it's maybe not like a change that you notice, but it kind of keeps you where you are. So you're not, you know, aging as quickly maybe.
It's so funny because we've been talking about this for so long now, for almost like 6 years or so. And now just sort of in the public eye, people are talking about like collagen banking and all these like trends on TikTok. But really that's what's been going on. It's these like long-term gain procedures that make a difference. You know, you can call it collagen banking. You can call it,
what is that? What does that mean?
It means like trying to save collagen for later, you know.
So that saves it?
Yeah. So basically trying to, you know, take your body's cells and make new collagen. So later on it really helps to hold the shape.
I see.
And yeah.
Okay.
So
okay.
You've been on that trend for longer than it's even been around. Yeah. So you're doing a great job.
Yeah. No, I love a non-invasive laser.
Yeah.
Anything that, you know, you can walk out of your office and, you know, I mean, what do you do? The little micro.
The picotoning.
Pico. Yeah.
And that's actually, I learned that when I was making my skincare in Korea. Like I went to Korea to make my skincare line, and it's such a big popular procedure because it's minimal downtime, but it's really helping to just start the skin cells to create new collagen, even out skin tone. And it's really something to help maintain and last over a time.
Yeah. And you're a little pink afterwards and that's it.
People want zero downtime, especially in New York.
Yeah. No, I mean, I know that if you do if you burn the skin off and it heals, you have a long-term benefit and fewer lines and whatever, but
the downtime's real. Yeah.
Yeah. I think
People, I don't think, realize that you can actually remove radiation tattoos. They're like a real tattoo. So
yeah, they're ink.
Yeah, they're ink. And so we can remove them with a specific type of laser that I think it means something, right? Like when you're at the end of the journey.
Yeah, I've met people who have wanted to keep them as like a mark. And then for me, I had one, I'm like right in the middle of my chest.
Yeah.
And then one here, and then it kind of went around. I think there were 8 of them. And whoever tattooed me was nice enough to make it super light on my chest. And that one went super quickly, but certain like other ones, they're still like
they took
marks.
a while.
Actually, I'm thinking of getting like a brown tattoo over it to make it look like a freckle because it's blue now.
Yeah, they can sometimes be quite deep.
Yeah. The one like there just doesn't want to go away.
Yeah, and they can take like multiple treatments to get rid of.
Yeah, we did them a bunch of times. I think, and then also for the scars, you have lasers that help those really like take the redness out like that, which was great.
I have worked with a lot of patients who say like the scars are sometimes just reminders of things, so they really do want to help mitigate those scars, especially in like the younger kids who undergo treatment. They just they don't want to walk around with scars, you know, on their skin. It can be really a reminder.
I agree. It's just a mark that makes you remember, which it's fine, but sometimes it's nice to not have to think about it.
Yeah, there's an emotional aspect to it, and you have quite a following of people, and like they reached out to you. I mean, do you sometimes feel overwhelmed by people reaching out, or? So
I've actually written a lot about it, and initially my Instagram's private again. I'll probably put it public again soon. But during that whole, year and 2, like the year after, probably like 3 years, I had it open, and a lot of people reached out, and I shared what I learned, not in a way that, like just a way to kind of educate people, because I feel like so many people, there's such a stigma still attached to people who have cancer because people don't understand. It's like, ignorance leads to fear, I think, for a lot of people. So just letting them know, like, you know what, I'm okay. Like, it was a really hard year, and you're going to be okay. Yeah. It's going to be a hard year, whatever it is. And all this stuff that happens to you, whether it's skin changes, you heal, like you end up healing, right? You think it's permanent. You think you're going to look completely different, and things heal. You get back to where you were, and you're like, and life goes on. You're changed, but life goes on. And I think just showing people that it doesn't really fundamentally, you grow, but it doesn't change who you are. And I wanted people to see that, because I think you're terrified. You're terrified of the unknown. So just showing I didn't show like, the chemo needle in my arm or anything like that, but I just showed sort of, just like anyone getting over a high hurdle of placed in front of them.
I think, you being a resource and advocate, I mean, I think people really resonate with that, because it is fear. It's fear of the unknown, fear of the actual going through everything, maybe the fear afterwards as well. It's really, I mean, it's powerful. And I know a lot of people that meet you could never even imagine.
No, well, I forget.
Yeah.
I forget sometimes,
That's interesting.
you know,
Okay,
it, you know, I'm 6 years clear now. So yeah, it feels like sometimes it happened to somebody else.
And has your writing evolved because of that, or
yeah,
what
it goes through
era
phases.
are you in
So,
now?
yeah, I wanted to share a lot, and initially I did. Then I helped launch a website with someone who's become a friend of mine now called Staged, that basically provides all the stuff that you need from, you know, your creams are on there now too. So it's, you know, different things to treat skin or turbans, all the stuff that you need, soft pajamas, everything. And then there's another side that's editorial that basically tells you everything that you go, like if you, what this kind of chemo is like, what radiation entails, you know, what you should eat, all this stuff. So I helped write about all of that there. And at a certain point I was like, it's too much, you know, cause I felt like I'm re-walking through chemo. I'm going back through radiation and like, you know, and I did it, but then I needed a little breather.
Totally.
So yeah, so I took a breather and I went back to, so I was in graduate school. So I was applying to graduate school when I got pregnant with my first 100 years ago. He's 16, almost 16 now. So when
he's super smart. Yeah.
okay. So then when the youngest one was in kindergarten, I went to grad school. So I did this 2-year program, finished that. That was for, instead of being a journalist, I wanted to switch to fiction. Got my diagnosis before I even graduated. So, you know, obviously life took a different trail through the woods. And I came out of that thinking, okay, now do I have to write a cancer memoir? And I wasn't interested in that. And now that I'm approaching, there's this thing in writing where they say you need 7 years to kind of process something, whether you're going through a huge life change. Don't write about it for 7 years. It's only this year that I started reading other people's writing about cancer. Emperor of All Maladies, that's amazing. But I'm also reading, I think, In Between Two Kingdoms now, which is about a younger woman who had cancer. It's only now that I'm starting to like read these stories, and I'm considering maybe doing that. But there's something about just writing straight up fiction that's, you know, I just want an escape. So.
I love reading. I love reading your writing. It's interesting.
You're one of the
few
people I've shared it with.
I know.
Some of these stories.
I feel privy, so I can't wait until the rest of the world gets to see it. Yeah, and read it. Very cool. Very interesting. Hey everyone, I want to take a quick break from today's episode to introduce you to a fantastic tool, Hygge Health Light Therapy. This light therapy device harnesses the power of red and near-infrared light to promote skin rejuvenation, reduce inflammation, and even help with collagen production. It's a safe, non-invasive way to brighten up your complexion, ease muscle tension, and improve your mood, all from the comfort of your home. I've seen remarkable benefits with light therapy, and Hygge Health makes it easy and accessible for everyone. So if you're serious about glowing from the inside out, Hygge is your go-to. Check out hyggehealth.com and use code GiveGoodFace for an exclusive discount. Glow brighter, live better with Hygge Health. How do you feel about the world that we live in today? Sort of, I know that's a big question, but like the world of beauty and fashion, it's really evolved from when we were at NYU.
Yeah, totally.
But yet some things have come back full circle.
Yeah, it's funny. So when I was reviewing products, I was in my 20s, and I would get sent a $900 cream, and I'm like, but like, how can I tell if it works?
Perfect.
Yeah. I don't know. So then you're writing about it, and it's similar because you watch all these influencers who are getting products and getting paid to talk about them. And I think you really actually have to use a product, like a full size product.
Definitely.
You know, couple of months at least to see whether or not it works.
Yeah. And we see Gen Alpha now using, like, raiding Sephora and going in and buying all these like expensive products, and their skin is, you know, prepubescent, which doesn't even have like the sebaceous gland activity or any of the hormonal influences that they get during puberty. So it's sort of like they're just using all these expensive creams as for nothing.
Yeah. No, I'm more interested in like the makeup thing.
Yeah.
I feel like I learned so much from the kids.
The makeup tutorials. Yeah.
Yeah. I'm like, oh, that's how you do it.
There is something very like mesmerizing. It's almost like ASMR, you know, like, So we could do a little bit of that.
That would be fun. That would be so fun.
That's awesome. Yeah.
Yeah. No, I think there's so many amazing advancements and, like even what you're doing with the sea anemone.
Yeah, I know it's hard to say. TRPV1, yeah. The inflammatory aging.
Yeah.
I mean, your lifestyle is very much akin to that. Like you eat really well.
Yeah, but it's all inflammation, like trying to tamper the inflammation that's from stress, from foods. I have celiac disease. My skin is super sensitive.
What was the journey like that? Because there's many people that might think they, have an inflammatory diet and not really know.
Yeah, I think I was always such a healthy eater. And then with the whole cancer thing, I just sort of was trying to figure out, well, what, of course you go down this deep dive of what caused it. And you think about the gut and the link between, the brain, the gut, and your whole system and the inflammation. So I did all of the blood tests and tried to figure out what I was sensitive to. And, I'm not supposed to have dairy. Did I have like dairy today? Yes. You have to live your life, but at the same time being aware of things that trigger, like I had wine last night and I can feel it in my sinuses. Like I know that's a histamine reaction.
Yeah. Totally.
And that you said I have, what am I, hyperhistamine?
Oh, dermatographic. Yeah.
Thank you.
Dermatographism was when we write on the skin and it sort of makes a wheel. And so it's a marker of how much histamine you can release in your skin.
How do I have so much?
It's interesting. I mean, there's obviously a genetic component to this, and like some people have it, some people don't.
That's inflammation too, right?
Yeah, in a way, like your allergy cells, your mast cells are releasing histamine, and that causes like an inflamed part of your skin. So
does your cream help with that? That
is a very specific reaction, like from striking the skin or rubbing, and it's almost like the pressure. And some people have really distinct dermatographism. I actually have a photo from an artist who has such distinct dermatographism that she can write on her skin in words and they like appear as hives. Yeah, I would not recommend it. So that artist,
a belt, and the belt is like on me for an hour after I take it off. Yeah,
so that is like a very specific form of urticaria or hives, and it's really interesting. The body is so fascinating, and skin is like sort of a manifestation, a visual manifestation of that. But yeah, so it's interesting. I feel like you're very aware of, your body and how it works.
Yeah. I think you kind of learn to be also with time. And I just noticed how different things affect me and try to be aware of it. And, you're a doctor, you can talk to doctors, but it's like, you're not living in my body.
Totally.
So if I explain something to somebody, they're like, oh, you're fine. But then it turns out, okay, actually, I don't know, maybe I'm not.
No.
I found my cancer myself. It was just like a little bump and like, oh no, you're so healthy. It wasn't hard, it wasn't hard.
Yeah.
I was young. They always said cancer's hard and it doesn't move. It felt like a soft little tiny thing that just wouldn't go away. So, it's
you
just
bring up
listening to your body and
that's a great point. Like you have to be your own advocate at some point. Yeah. Exactly. And I think you have an eloquent way of like describing things. So I think you can communicate very well. But even so, like if you have some feelings, like it's important to like tell your physician or, talk to someone else about it.
And if it continues, I'm not saying it like if you have a new thing every week, then maybe
of
that's
course.
another thing.
No, yeah.
Maybe you're a hypochondriac. But if it's one thing that is bothering you and doesn't go away. I mean, you know me, right? If you do a laser and it leaves a mark and I'm like, is it ever going to go away? Like, you should have never given me your cell phone number. And to my kids, it's like, what is this?
Yeah.
Like, poor Anthony wakes up in the morning and he gets a text from like some random person's lip. And I'm like, is that herpes?
Yeah. No, as a dermatologist, we get inundated with like photos all the time. So, it's just par for the course. Or at parties, people like love to show you body parts, even though it's like pitch black and you can't see anything. And you're like, maybe you should make an appointment. But, it's what we signed up for. Yeah.
I guess so, man. I don't know. And then, oh God, I've had so many funny things that I've sent you.
Yeah. No, and so what do you think about, the world today there's a lot going on in the world today. It's election day as well. So there's a lot, but what are you excited for in like beauty or like the trends that are going on now? I feel like you have a good pulse, especially you have teenagers. So you see it from all different angles.
Yeah, no, I think things that work are great.
Okay.
So there's this new form of Botox that's longer lasting.
Yeah.
It's coming out soon, you said.
Yeah, it's out
Like,
now. Yeah, Daxify. Yeah.
So I would love to try that.
Yeah.
That maybe it'll actually work on.
Yeah. It's supposed to last longer. It's a
You guys
little.
have that?
No, it's a little bit. We don't, but it's a little bit of a more of a dosing strategy too. Like you have to increase the dosage. So actually, we were talking about this on another podcast. Like adequate dosing and appropriate dosing is like really important for people's muscles because sometimes, the dose that you think might work for someone, their muscles are just stronger. They have stronger muscles, whether they look it or not. So it's important to get that feedback and follow up from the patient. That's why going to someone that you can see regularly and going back to, it's important. So they get to know your face.
Every week if I could.
Yeah. No.
Well, I guess I see you socially almost every week.
And that's so you're really into the science.
That I think the things like blue light. Both of my kids have a little acne, and putting that blue light panel over their heads.
Oh yeah.
I mean, they hate it. I'm the most annoying but it
helps.
they look so much better. Talk about inflammation.
Yeah.
It's so much less
blue
red.
Light has been shown to be antimicrobial.
It's
too.
amazing.
Yeah.
So they look like not 100%, but it's so much better after, 1 30-minute session with that panel over their faces.
How are you with your kids in social? Like, how is that?
My kids are like not into it.
They're
which
not
is
into
great.
That's amazing.
Which is so great. Yeah.
Congratulations.
I think, what did I show them? Not the Social Network. I showed them some documentary early on.
Okay.
And I terrified them because I was like, do you want to be addicted to your
No,
phones?
It's true. Yeah. I mean, I worry about the youth of today.
It's terrifying.
Because we're inundated by images all the time. Like, I guess you and I like look through magazines, right? Like when we were kids.
Yeah. Tearing out pages, dog earing. Yeah, absolutely.
So, we saw images through like
you'd have to
print.
like go to Bergdorf's to get the cream.
Yeah.
You'd be like, I want that. There was no internet.
There was no internet to get like a free sample,
No.
So, but now you're just fed images. And then soon in the future, you'll be fed AI generated images that are sort of just like programmed.
Already, right? These filters and everyone, if I have something on my skin, I'm going to, face tune it off.
Yeah, totally.
And that's what everyone's doing. And it's not a realistic depiction of reality.
Yeah. And I think to have a young brain understand that is quite complex. Like, I do think, at some point in the future, we might have to label things as like, manipulated with AI or manipulated with Facetune because it's just setting up a standard that's not achievable for the youth.
It's like airbrushing, right? In magazines.
Totally.
It's the same thing.
That's true. That's the same
But they're just
concept,
seeing more of it, and they're seeing it on quote unquote normal people, not celebrities, not models. I mean, also on celebrities and models, but also on, their peers.
Yeah. I mean, actually, you make a good point. I didn't think of that. Like, we were fed photoshopped images, right?
We're always going to have like body dysmorphia because of media. It's just...
It is. It's true. Yeah. And I think we're doing a better job of talking about it. Maybe?
I think there's certain also influencers who are like, well, this is me with it and this is me without it, just so people can see.
Yeah.
And, people like Pam Anderson wearing no makeup.
No makeup. Yeah.
There's there's good stuff out there.
I love that they call her brave for wearing no makeup. I know. But it's
she
great.
Looks great.
Yeah, she looks great. I mean, maybe you don't feel like putting on makeup, like maybe, that day you feel like you're just going barefaced, which is amazing.
Yeah, and also looks great.
Yeah.
Yeah.
We shouldn't like stigmatize people for not doing that.
No.
I mean, glam is fun. It's cool. It looks great. But like, I think we can also, understand and appreciate someone who's just, out there, which is great.
Yeah. I mean, hopefully.
It's brave. Yeah. This holiday season, it's really important to give good face. That means putting your best face forward and skin health. We all know that our skin affects our mood. It can really affect how we appear in social settings. So we really want to make sure that you are bringing your best skin forward. Use code GIVETHANKS30 to take 30% off all holiday season. Thank you.
I have a question for you.
Yeah, sure.
So I was using 0.05% tretinoin.
Sure.
Is that right?
Tretinoin. Yeah, the
tretinoin. You prescribed it.
Sure.
So then I'm getting like dermatitis between my eyes, so a little flaking. So then I went back to the 0.025.
Okay, nice.
Is that?
It's effective, yeah. So you make a good point because some people are like, I need the strongest dose.
Of course, I want the strongest dose,
Yeah.
but I don't think my skin can handle it. Or it can handle it. I just can't go in certain areas.
Exactly.
Maybe.
Certain areas of the face, especially some have more sebaceous activity or like oil gland activity. Others are drier, you know. Some are more sensitive, like the skin around the eye is like very sensitive. And retinoids they do a great job because the retinoids are prescription strength, right? So you can only get them through a prescription. Retinol is the derivative that's over the counter. Retinol doesn't actually work as well as a retinoid. It doesn't activate the receptor as well. So that's a good myth that you bring up. But the retinoid, we say go slow, right? Take it slowly because
I feel like I went slow
and you still got them.
And then I went to the 0.5 and I was very careful and I would skip a day. I did all the things you're supposed to do and I still peeling.
Because I mean, you have great skin, but it could just be too strong. And we actually recommend mixing it with moisturizer. Yeah.
That's a good idea.
Studies have shown it doesn't dilute the efficacy. It just gets rid of the dermatitis. So
well, that's how you mitigate it. There you go. Okay.
I actually use it off label, like all over my body.
Okay. I know. I start using it on my chest.
Yeah.
Also neck, right?
Yes.
So thyroid cancer is one of the cancers that younger people get, and it's more and more prevalent, as is many cancers. What about putting like vitamin A
derivative
concentrate on your neck?
So we haven't seen any effects from the topical, and we haven't seen any increase in necessarily thyroid cancer from even the oral. But there is this effect of, you know, if you're taking an oral retinoid, sometimes there can be thyroid dysfunction. So it's important to talk.
But do you think they've studied enough? Because every time I put it on my neck, I'm like, should I be doing this?
Well, we don't see it so much from just the topical application, but there is, you know, like isotretinoin with oral retinoids. We do want to make sure thyroid function is okay as well. Yeah. But, you know, we use isotretinoin very often in kids for teenage, like cystic acne, even adult acne. And we don't really see that much thyroid dysfunction, but it's good to know. I mean, there are a lot of medications that can affect people's thyroids too, which, you know, it's important. So if you are feeling, you know, these signs and symptoms of thyroid issues.
No, I'm not. I just am just aware. I have thyroid cancer, so every time I'm there. And also, you know, the magnet thing to like tighten, like stimulate your muscles. They say don't put it near there.
Yeah, they don't want to. Well, it's interesting because even like the abdominal muscle stimulator, you know, like
M-Sculpt.
Yeah, exactly. Like it contracts the abdominal muscle wall. You know, it can stimulate things deeper down. So like people have seen irregular menstrual cycles from that, you know? Yeah, because
how many times do you have to use it to get that?
Well, it depends, you know, the menstrual cycle, because it can stimulate the deeper muscles, like, you know, even like our intestinal muscles. So some people who have like really bad, you know, intestinal bowel disease, like may not want to use it. If you have an IUD in, you can't use it because it can actually, that muscle contraction can actually stimulate deeper. Yeah. It's actually powerful. Like the studies have shown on those muscle devices that you do increase like functional muscle use. And so like people can do wall sits, you know, improved. Yeah.
I did it with Brian on my glutes and my abs. And I noticed at the gym, didn't necessarily notice like everything going up north, but I could hold, you know, if I'm on doing a balance or something on one leg, it was like, I wasn't shaky at all. It was,
I think that's amazing that you say that, because I think that's where that technology can really help, is like give people better functional muscle usage and recruitment. Yeah. So it's so cool.
And it goes like, if you have a lot of fat, it goes right down to the muscle, or that weakens the machine's ability to get in there and control the muscle.
You'll still feel contraction in the muscle, though. If you're thinner, you'll probably feel a more vigorous contraction because there's not really that much impeding the way to get to the muscle. We
need to go do a set. We should take a panel.
You know, strap.
I tried to film it. It's like, oh my god,
it's wild.
Like pornography.
It's the future. You know, like we're augmenting what we have. So I call it like augmented beauty.
Yeah, it's like, how many sit-ups would you say for 30 minutes?
Oh,
like
yeah.
1,500?
Yeah, it's like in the thousands of punches. Yeah.
It's insane.
It may not be the same as like doing a crunch, but it definitely, like you said, you can feel a functional improvement, which is so cool. Yeah. Especially as we get older, we're losing muscle mass, you know, if you're not doing resistance training and such. Yeah. We're going to get into that on another podcast. So, yeah.
Yeah. Well, I'm not losing any muscle mass in my jaws.
No. Strong. Yeah.
Yeah. How important are expiration dates on prescription or sunblock.
Yeah.
Can you?
Expiration dates are important, right? Because there's active ingredients in these compounds, especially for prescription medications. There's also a preservative system in there. I do not use formaldehyde releasing preservatives in mine, but there are many that are out there. But the preservatives are important because once you open up the bottle, you usually have a use month that you can use it by. So you'll see on the package it says use within 12 months of opening. So that's important.
Or
too.
It just says like August 2025.
Totally. And that's the other expiration date. So even if you don't open it by August 2025, let's say, it's going to expire.
Okay. I feel like a lot of them don't say used by 12 months. If it's something like you compounded or it's a prescription, I feel like often they do.
Yeah,
but
you
if
might
it's
even
just,
just see a symbol that says 12 or 12M. That's what you could see sometimes. Yeah.
Google that one.
So take a look. Yeah.
I should pay more attention, especially for things like
sunscreen,
makeup.
Definitely.
Yeah,
as
sunscreen
well.
I don't mess with. I did once bought a sunscreen at a hotel, went out. It was in Mexico. I got the worst burn of my life.
Oof.
And I was like, why? And then I looked.
Exactly.
Expired.
And you bring up a good point, makeup. People need to change their makeup. Bacteria grows.
So gross.
Yeah, the brushes, like.
I had no,
You know.
You have, I had someone tell me all about that. Now I throw stuff out. It's also good because you can keep it fresh.
Yeah, keep it fresh.
Yeah.
And then endocrine disruptors.
Yes.
You and I talk about that a lot. There are a lot of compounds, and that's why I stick to pure physical sunscreens. Like, I love the physical mineral sunblocks, the zinc and titanium dioxide. There are chemicals that have been shown to, in the lab, interfere with hormone function, or that's what is called endocrine disruptors. And I think more and more people are becoming savvy on those.
100%. I mean, there's so many studies now with data that indicates people who used a lot of hair relaxers or straighteners and the link between various different kinds of cancers, uterine, breast, endometrial.
Yeah.
And they're all endocrine disruptors. So I had a estrogen receptor and I had ERPR positive cancer.
Yes, yeah.
So I wonder if there was something I was exposed to, especially through adolescence, right? So I think there's more as you're going through those body changes or pregnancy or even menopause, if you're exposed to these different kinds of disruptors.
Yeah. It's really, we need to do more work on this. And the industries have to do a better job of also being transparent, I think, and, including this. I think we're going to get to the point where you really do have to state like what's in these products.
Other countries, you're not allowed to use so many of them.
Exactly.
And here, you can use whatever you want, basically, besides I think it's 9 things but if you go to France or even England, I think they have
tighter regulations.
100%.
I do think our industries need to step it up a little bit. And
100%.
It's like one of the reasons why I made my skincare line is because I do want to be transparent with people and also get rid of those things. We don't really need them in there.
Absolutely, but also there are natural things that are endocrine disruptors.
Totally.
So
exactly.
you and maybe you're using lavender oil, but that actually and huge doses, but still, it's just awareness.
And that can also just irritate the crap out of your skin.
Reactions my kids have ever had are like weird Whole Foods sunscreens that, are all natural and they end up with like sausage fingers from applying it. Like, what happened?
Yeah, because natural
it's not.
We always say like poison ivy is natural, and it's no one really loves that. Yeah, thank you for bringing up all these points. I mean, I think you're one of the most savvy people I know.
Wait, before we go, one more thing.
Oh yeah,
the estriol or whatever that you put on your face. So as people approach menopause and lose estrogen, and people like me who had breast cancer, estrogen receptor positive. Does it make a difference, and can I use it?
I actually
when that time comes.
Yeah, which is far away. I actually just got a call from a news outlet about this because there is this rise of estrogen-based creams that are on the market now, direct to consumer, online. Really touting the effects of hormone replacement, especially for perimenopausal or postmenopausal women. Obviously, premenopausal women, they have their estrogen unless you're blocking it for certain reasons. I do give people, just food for thought, because if you did have breast cancer and you did have, an estrogen receptor breast cancer, you really need to talk to your doctor or your oncologist before you're putting on any exogenous hormone product, right?
Sure.
Because things do get they basically get systematically absorbed through the skin. So if you're putting estrogen on the skin, it's going to get absorbed into your bloodstream. And if you do have an estrogen receptor positive cancer, that's really important to know. People sometimes, we've seen like people put tons of product on their skin or all over their skin. And
it's an organ, it absorbs.
Yeah, the more body surface you use, the greater the absorption.
I know, that's what I wonder. There's so many unknowns.
Yeah, there's more data that needs to be done.
Yeah.
Stay tuned.
Exactly. Exactly.
So thank you so much for being on this.
Thanks for having me.
Yeah, you're awesome.
This was special.
I hope you come back. Thanks so much for listening to this episode of Give Good Face. Subscribe on Apple Podcasts, Spotify, YouTube, and wherever you listen to podcasts. And follow along on social at Dr. Anthony Rossi and at Rossi Durham MD.